COPD is a chronic airflow limitation, and the NCLEX is going to want you to remember the number one cause, which is smoking. And that's because smoking damages the alveoli and the airways over time, restricting that airflow. And this is going to include either chronic bronchitis or emphysema, but most patients are going to have features of both. And so the difference is simple to remember. You've probably heard chronic bronchitis called your blue bloaters, so all B's over here, and your patients with emphysema called the pink puffers, so the P's over here. And chronic bronchitis is just when smoking causes excess mucus and airway inflammation that narrows this airway and prevents air from getting in. So these patients are going to develop hypoxemia and cyanosis. That is what makes them blue. And then we also have a couple secondary effects from that hypoxemia. So first, polycythemia. That's that compensatory increase in red blood cell production. That's just the body's attempt to try and get more oxygen carrying cells through the body. But that creates this blue appearance as well. And another response to hypoxemia is pulmonary vasoconstriction. So those pulmonary arteries will constrict, and that increases the pressure on the right side of the heart and can cause right heart failure. And when right heart failure is due to a lung problem, it's called cor pulmonale. So if they develop heart failure signs like edema, that's what gives that bloating appearance of the blue bloater nickname. So if chronic bronchitis is characterized by hypoxemia, emphysema is characterized by air trapping. And that's where smoking has damaged the alveoli themselves. And so normally in a healthy alveoli, it blows up like a balloon. And then when you let go of the balloon, the air exits smoothly. But patients who have emphysema have alveoli that's become less like a balloon and more like a floppy plastic grocery bag. So when they try to exhale air, the alveoli just collapse in on themselves, preventing air from getting out. So they have air trapping. And that's going to create this inflated barrel chest appearance where their AP diameter increases, causing them to look kind of like their chest has become a drum. But these patients don't develop hypoxemia the way that patients with chronic bronchitis do, because they can puff or use their pursed-lipped breathing to help hold the alveoli open and push that air out. So that's why they are called pink puffers, because they stay pink by puffing out their air, and their chest has that puffed out appearance as well.